Good morning, all. Today, we are going to discuss the case note of Nasir Ali. Who? Nasir Ali. The patient name is Nasir Ali. We all know that if you want to write a letter, definitely we have to have a case note, right? So we are going to check the case note first. And one more thing that you know very well, that whenever you are getting a case note, the first thing that you have to check is what? To whom you are going to write the letter. Okay, for that one, we have to go to the down part of the letter or case note. You can see here the writing task. A subheading is the writing task. I'm going to read this writing task for you. Using the information in the case notes, write a letter to the social worker Sarah McDonald, Annalee Community Center, 1122 Ipswich Road, Annalee 4121. Okay. By reading this writing task, we understood that we are going to write this letter to a social worker, and her name is Sarah McDonald. Okay. So, social worker. When we are writing a letter to a social worker, the first thing that you have to remember is that we have to give much importance to the social contents, not medical conditions or medications. Got it? Okay. So, keeping this view in our mind, we are going to check which bullet points we have to accept and which we had to omit. Okay, the first one, today's date, 19 February 2012. You are Louis Nagatini, a registered nurse in coronary care unit at General Hospital. Nasir Ali is a patient of your care discharge summary. The first thing that we have to take from there is the patient name we already took, and we are writing to a social worker. That's fine. And what points we have to take? We can check like this. Today's date. We need the date always, right? So we took the date. Date is 19th February 2012. Anything else do you want from here? You are Louis Nakatini. You have to know, or you have to have the name of the nurse. So we took that also name. Nurse name is Louis Nakatini. And she's a registered nurse in coronary care unit in general hospitals. We have to get the designation, working in a coronary unit. And the name of the patient we already know, that is Nasir Ali, we already took, and is in discharge. Okay, now we can check the summary. From summary, we know the patient name, so we are not going to take this one again. And the second part is the address. Do we need the address? No, not at all, because it's not that much important to write the address. The next one is the phone number. Definitely, we don't want that. And the next one is the date of birth. Yeah, we need the date of birth, right? Patient's name and date of birth is 4 February 1964. And date of admission, do we need? Yeah, we need that, because when we are writing the second paragraph, the chief complaint paragraph, yeah, timeline paragraph, in that we are definitely mentioning on which day he admitted to the hospital. Okay, so we will take that also. We need the date of admission. It's 9th February 2012. Then diagnosis. It's MI, myocardial infarction, right? This also we need, because, yeah, this one we will mention the paragraph number 1, yeah, in paragraph 2. So diagnosis, definitely myocardial infarction. This also is needed for us. The next one, date of discharge. Already we took that one, because the date is already here, 19 February 2012, and this one is 19 February 2012. So we took the date already, we can see here. The date is there, so we are not at all going to take that again. The next one is the name of surgery, CABG. That also needed, right? The procedure done, name of the surgery, CABG. That point also we need. Okay, coming to the next part of this case note, reason for admission. The first one, patient arrived to the hospital via ambulance 10 days ago, suffering from acute substernal chest pain radiating to left tab. Okay, when he came to the hospital, already we are going to write the dates there. Okay, and how he came, that's not important for us. Let's just, we want to know that when he came there and what was the condition of the patient. So we will write the reason for admission is chest pain radiating to the left tab. Okay, date we already selected previously. That's why we are not at all thinking about the date here. The second thing, he complained of severe chest pain, then pain in jaw, left hand, dizziness, shortness of breath, all these things, right? Do we need that? Not at all, because it's like listing. The patient has diagnosed with myocardial infarction. Condition has now stable. However, he appears listless and worried about his condition. Diagnosis we already took, and only the thing that he had to take from here that he is stable. Stable. He appears restless, but when there is charging time, it will be fine. So there is no need to write that. So we are taking only one point that his condition was stable during the post-operative period. Okay. The second thing is that we can see he's overweight and is a smoker. We are writing to a social worker. So definitely we are going to include that points. That means Mr. Nasir Ali is overweight. And what he used to smoke. He's a smoker. Okay. So next thing, he has a high BP. This one, it's a medical condition, but we are going to express that also. That is, sorry, we are not at all going to express that one. We know very well that the social worker is not at all going to check the BP of the patient. So we are omitting that part. Then the procedure done, that we wrote in the paragraph number 2. Then the treatment, in treatment we need anything? No, all these are the medical conditions. So we don't want anything from here. Because this patient, social worker, he don't want such kind of information. Then social history, right? In the social history, the first thing is family, a refugee from Afghanistan arrived by boat in Australia in 2010. We are not at all interested in how he reached Australia and when he reached Australia. Only the thing that we want to know is that he is a refugee from Afghanistan. So we are including that point, refugee from Afghanistan. Okay. The next, marital status, married, 7 children, aged 6 months to 22. Married, that is needed for us. He's married. Okay. Next to kin, Fatima Ali. That is a semi-relevant point. If you want to include that, it's fine. Otherwise, leave it, no problem. Employment. He works as a taxi driver. That's needed because we do have to know his job. Okay, he is a taxi driver and his wife is housewife. Then that's also not much needed. The next one is accommodation, living in a rental flat. That's been needed, right? Living in a rental flat and no family doctor for him. That also we have to mention. The next thing is that Daddy Nasir attends TAFE English classes, but only has basic English conversation ability, right? Okay, so he can communicate basic English only, not more than that. That also we have to mention to the social worker, no basic English. And the discharge plan, we can check here, follow-up appointment with the cardiologist. Definitely, the social worker is not at all going to do that one. Order medication, no need. Arrange a dietitian to provide dietary advice. Yeah, that we can do. Arrange a dietitian to provide dietary advice. And the next one, discuss the importance of giving up smoking and provide advice on available quit smoking programs. This is a needed one, right? Okay, so we are including that point, quit smoking program. The next one, advise patient to continue with exercise programs recommended by the hospital physiotherapist, particularly deep breathing exercises. Okay, so this one we are not going to say to the social worker because the physiotherapist already instructed that to him, and definitely on discharge time, the nurse also will explain that things to him. So we are not going to include this point here. Arrange a community social worker to provide support service to the family to ensure the smooth transition back to normal. That we already going to do here, right? This is the letter. Okay. Now we are going to discuss how we are going to write the letter. And I'm not at all going to say that how to write the date because we know the things how to write the address. You know all these things. So directly we are moving to the introduction part, paragraph number 1. Okay, I told to my students previously that whenever you are writing an introduction, you have to make sure that you are mainly including 3 things. The first thing about who you are writing. The second thing, what is the condition of the patient. The third thing, what you are expecting from the reader. Okay, so we can check the introduction part. I'm writing to request your assistance and support for Mr. Ali, Nasir Ali, who needs a close adaptation to normal life. He has been recuperating from myocardial infarction and is being discharged today. Come back to the point I discussed previously. The first thing I said is that when you are writing an introduction part, you have to make sure that you are writing the name of the patient. Yeah, it's there, Mr. Nasir Ali. His condition, his condition, he has been recuperating from myocardial infarction. Okay, and what he need assistance support for what? For a close adaptation to normal life. Got it? So these three things are there. So we can move to the next one. Next one is the timeline paragraph or the chief complaint paragraph. There, we will write the details, how he came and what procedure we had done. So it will be like this. Mr. Ali was admitted to the hospital on 9th February 2012 with the symptoms suggestive of the above mentioned medical condition and underwent a coronary artery bypass graft successfully. Okay, you may have a confusion that why you didn't mention the name of the disease or diagnosis here. Actually, it states that we should not have to repeat the things, and we already said what is the medical condition. His medical condition is myocardial infarction that we mentioned in the paragraph number 1. So we are not at all going to say the same thing again in the second paragraph. That's the reason we wrote it like this. He came to the hospital and his symptoms was suggestive of what? Above mentioned medical condition. And we already wrote, we already selected the point about the procedure done in the hospital, right? That is what? He underwent a coronary artery bypass graft successfully, and his post-operative period was uneventful and has been initiated physiotherapy there. So paragraph number 1, paragraph number 2 finished, and paragraph number 3 you know very well. What is that? It's the background. And you know very well background of two types, not two types, two classifications are there. The first one is the medical background and the second one is the social background. And you are writing to a social worker. So you have to give much importance to the social background, not to the medical background. Okay. So we are writing the points. I'm not giving the exact paragraph here, but the points you can rephrase it and make a sentence and write the paragraph here. Mr. Ali and his family are refugee from Afghanistan. At this point, you have to include there. He's a taxi driver. This also you have to include. Lives in a rental flat. He just knows basic English, not more than that. And a family doctor for him or his family. Okay. Then he is overweight. He smokes. And BP, okay, we can say just it's a semi-relevant point only, but we will say that he is a BP patient because BP patients have some irritations while talking. So the social worker should have to know that matter. Okay. So paragraph number 3 finished, and now we are going to discuss paragraph number 4, that is called the recommendation. And in recommendation paragraph, it would be appreciated if you could arrange a support service for Mr. Ali and his family. Kindly educate him regarding the importance of quitting smoking and advise him on available smoking cessation programs. These are the recommendations. That means he have to get support and he has to be educated regarding how to keep smoking. Okay. The next one, paragraph number 5, the closure. Your further queries upon this letter will be a matter of appreciation, ending and signature. Yours sincerely, Luis Nagatini, Chargers. Hope you enjoyed this video. And if you enjoyed this video, please like, comment, and definitely subscribe. Till then, bye-bye. Take care.